welcome to the next episode of Pathagonia. So today we're going to stick with our hematopathology theme. That's the rotation I'm on this month in residency. So this is a bone marrow biopsy from a patient, and as you can see we have the core biopsy here. This is often taken from the patient's iliac crest or the iliac bone. So today we're going to talk a little bit about myeloproliferative neoplasms. So according to the most recent edition of the WHO, the classification of myeloproliferative neoplasms can be broken up into BCR-ABL1 positive and BCR-ABL1 negative neoplasms. So the BCR-ABL1 positive neoplasm is chronic myelogenous leukemia, or CML, and that's what we're looking at here. The other ones, the BCR-ABL1 negative neoplasms, are polycythemia vera, essential thrombocythemia, and primary myelofibrosis. But what we're looking at here, and thank you to Path Presenter for this case, is a patient with CML. We don't have the patient's age or their gender, but with CML, they're going to be BCR-ABL1 positive, and their bone marrow at low power, you're going to see a very high cellularity. So we see lots of cells, and many of those cells are going to be granulocytes. So if we did have a blood smear from this patient, you would see leukocytosis, a granulocytic left shift, and absolute basophilia, or even eosinophilia. And in 50% of patients with CML, you're also going to see a lot of platelets or thrombocytosis on the blood smear. CML can be split up into three different phases. You can have the chronic phase, the accelerated phase, and the blast phase. And clinically, these patients are going to present with fatigue, malaise, night sweats, weight loss, and abdominal enlargement. So you can see a lot of neutrophils or granulocytes in this bone marrow. You can't really appreciate, or at least I can't, a lot of basophils, but that would be something that we would commonly associate with CML on peripheral blood smear, a lot of basophils or absolute basophilia. The classification of myeloproliferative neoplasms can be split up into BCR-ABL1 positive, which is chronic myelogenous leukemia, or BCR-ABL1 negative neoplasms, which is polycythemia vera, essential thrombocythemia, and primary myelofibrosis. And that's it. Thanks for watching Pathagonia, and like and subscribe.